Alternative medicine. As a definition, it's any form of medicine or healing that falls outside the practice of Western medicine. Western medicine is what we know of as hospital practice, clinic practice, any insurance-based medical practice. That usually means a physician who's been trained in a DO or an MD school. That's usually 4 years. The Western medicine's been around for a short time. Alternative medicine, at least the whole system approaches to alternative medicine, have been around for centuries. Now, there are certainly different forms of alternative medicine. I would, as a doctor, only want the ones useful that have been proven and are actually whole system approaches. Traditional Chinese medicine is a typical example. It's been around for about 2,500 years. It approaches not only moving energy, like these meridians depict on humans. If there's a blockage somewhere along the line of one of these 12 meridians, using needles can help move the energy and unblock the channel. Now, there's more to it than that, but most people who have been through medical acupuncture usually feel great after having acupuncture, and it'll speed up the disease healing process. And again, even before prescription medicines came out in the recent few hundred years, traditional Chinese medicine used acupuncture, herbs, manipulation of diet to make people feel better, get people to heal up. So it definitely has its proven track record. Its anecdotes have been proven with people. If you talk to neighbors or friends, they've probably tried it and found either good results or mediocre results, but still, there are a lot of people who are investing in it. And it's because either they don't like the way Western medicine has gone, or they're looking for an alternative, and this is a safe one. The only problem is that it's getting better in the United States, but you have to pass through certification to practice and see patients. And that's nice because you have to jump through hoops, prove your knowledge, prove your training, and it kind of across the board gets everybody, so you don't have just anybody practicing on seeing patients and healing. But bottom line is that it has a whole system approach. The traditional Chinese medicine doctor uses herbs, uses botanicals, uses energy movement in the form of acupuncture, cupping, massage to help people feel better. There's also community and exercise that helps people feel better. That's a whole system approach. That's kind of what a Western medicine approach is lacking, because in Western medicine we write prescriptions, we take care of specific symptoms. Sometimes we forget to address, well, how's the family doing? What are you doing to get out in the community? How are you eating? Especially the eating part. So that's one of the downsides of Western medicine, one of the upsides of the whole system approach of traditional Chinese medicine. There's also Ayurveda, which is the Indian approach to healing. Again, about 2,500 years old. They don't use needle acupunctures, but they use pressure points, they use marma therapy, they use herbs, food, community, healing to get the person to feel better. Those are two different approaches, but they're whole systems. And they have been true. They have a track record that's proven very effective. Yoga in Ayurveda is very popular now, and just the act of yoga itself, or the practice of yoga itself, usually people who have injuries, they feel better after yoga. And it's probably not just because of the stretching and flexibility, it's because of the breathing, it's with the relaxation, it's because of the healing from that. Same thing with traditional Chinese medicine. There's things called Qigong or Tai Chi that practitioners of those two forms of exercise feel great and will swear by it. And they won't leave it, they won't put it away because they just feel so good with it. There's something to that. So these whole system approaches to healing are the best ways to depict or define what alternative medicine is about. The smaller branches that you might find with alternative medicine, as far as Reiki, which is energy healing, also a good track record. Other ones, you have to do your homework and you have to research. Sometimes if it hasn't been proven and you rely on just that for, say, changing around cancer, your chances for success or survival will be low. If you have something with a proven track record and you rely specifically on the old ancient ways of healing, you might fare well, but again, it's a wise decision. So between Western medicine, between alternative medicine, or the practice of integrated medicine, the doctors and the healers are supposed to guide you as patients on what the best choices are. It's never one size fits all, so everybody kind of has a mixture of where they would fare better, and for the reasons that everybody's different. So as long as you understand where to go and how to make your choices, I think that would be the best thing. Today we're going to videotape a patient getting acupuncture for a rash.
Those are from May, right?
Right.
So these are relatively still new because this is quite big.
Yeah.
And do you have all these even on the groin area?
Not in the groin, but in mid-thigh. Right
In the
over
inner,
here.
okay,
Yeah.
it's the inner side, but not in the groin area. Okay. I'm going to let you sit down, and I'm going to do some Chinese way of diagnosis. Okay, I'm going to feel your pulse and look at your tongue. That's my way to get the information, see what's going on. Okay. So. Anything else bother you besides this? You know, if we don't talking about the, condition diagnosis, just from how you feel.
I feel pretty good. I was telling Rick that sometimes I get leg weakness when I go up steps.
Okay. Weakness. Okay.
Right. No numbness, there's no pain, there's weakness.
Okay. And any headaches?
No.
And your vision's good? No.
Fine. The glasses.
But no blurry, no dizzy, any running in the ear?
No.
Okay. And this were worse at night.
Right.
Does wake you up at night?
Yeah, it gives me up.
Okay, so it does make you trouble to sleep.
Yeah.
And it's trouble staying. Go downward.
Yeah, no.
Okay. And the same thing here. Okay. Feel it?
Yeah.
Okay. Good. Hurt here, correct? Anywhere still itchy right now? Are they all
You feel
gone?
sleepy after that, or anyone in particular?
Not really, but I think all of them made me just loosen up.
You notice any heat or dizziness or anything like that? Any pain?
Here, when I think it was here, was pressed on this part. That hurt.
Okay.
It's pressed on two spots. One here, this one hurt.
Okay. That was part of the liver meridia. She said when she read your tongue that your liver gallbladder were congested or backed up, or red. So how about, what can you say about just the treatment, the acupuncture treatment altogether? What comes to your mind right now?
Well, it's different, you know. You don't really feel the needle go in.
Okay.
But sometimes you feel the heat from. It's not a stick that you feel heat go in.
Okay.
And I didn't know what, I couldn't really tell whether it's needles, whether it came out or how to place them in, or but the instant you took them out, can't tell.
Okay. How about itching?
Yeah, a little bit over here still.
Better overall?
Yeah, much better.
Feel much better?
Yeah.
Okay, good.